Okay, here we go. Thank you. Good evening, everybody. Welcome to tonight's health scrutiny meeting. My name is Councillor Daniel Crawford. I chair this committee. It's my great pleasure to open this evening's proceedings. We start with apologies for absence, and I have apologies for absence from Councillor Mahinda Midha. I'm unaware of any other apologies for absence from councillors or members of the panel. If colleagues know of somebody who isn't going to be here or can't be here, could they indicate? Otherwise, I'm going to move on. We have no urgent matters that I'm aware of for consideration this evening. Item number 3 is declarations of interest. Does anybody have any declarations of interest? Piotr, I think I can see you indicating.
Yeah, it's just the usual one, just to mention that Ealing Community Transport does provide contractual services for the council for the transport of children and adults with special needs.
Of course, thank you very much. It's not pecuniary, I don't think, to tonight's business. I can't see anyone else indicating that they have a declaration of interest. If we miss one, we can always come back and record it. I'm not aware of any matters to be considered in private ahead of it on the agenda. Everything is public and open for discussion. Item number 5 are the minutes of the meeting on the 3rd of November. Are there any comments on the accuracy of those minutes? Any requests for changes? And I can't see any indications. Can I confirm that we can approve those as a true and correct record of the meeting on the 3rd of November?
Yes, Chair.
Thank you, Councillor Mohan, and I'll assume from the complete silence of everyone else that you're all in agreement with that. So thank you. We'll get those signed and approved. Right, on to the business for this evening's meeting. We're going to take an update from Anna Brydon and Neha Vinodkat on COVID-19, vaccinations and Omicron, I think. I'm not sure who's going to start.
Yeah, I'll start, Chair. Thank you. Evening, everybody. I'm Anna Brydon, Director of Public Health. Kerry is going to very kindly share his screen on my behalf. Thank you, Kerry. So I'm just going to run through a very brief version tonight of the updates and then pass over to Neha, who's going to talk through the vaccinations update, which obviously has been very busy recently. So just a few slides from me tonight. Things have been moving very, very quickly since we last met as a panel. So I'm just going to bring you kind of right up to date, but obviously happy to take any questions if there's any details missed. As you're aware, over the last couple of months, we've been seeing the new variant Omicron in the UK and other countries, and that's really increased our rates, particularly in London, since about early December. As you can see from the small graphs on the bottom right here, this is a national picture. Number of people testing positive has really increased rapidly over December, and especially just before and over the Christmas and New Year period. And that was a much steeper rise in London. We have been then, as a subsequent to that, we have been seeing the number of patients admitted to hospital and the number of deaths rising as well. Those two are not, sorry, let me start again. Even though the number of infections and the number of positive results is much higher than it was last January, it's been very, very high recently. The number of patients admitted to hospital and the number of deaths is much lower than that peak, obviously as an impact of the vaccinations providing a lot of coverage. But there's still time to go with that. I think there's discussion about whether we have or haven't yet reached the peak in the UK of this variant surge, and the admissions and then the deaths all have a lag in time. So we're expecting those to potentially go up or flatten before they go down later in the year. If we go to the next slide, please, Kerry. So in Ealing, we've been seeing a similar pattern. London has seen a much higher surge than the rest of the UK so far. Ealing's been actually at the lower end of London. A lot of South London was very, very high getting towards Christmas. But we are seeing very high rates in Ealing. So at the moment, we have a rate of 1843 per 100,000. London went higher earlier than Ealing and went down earlier than us. So we are now showing as one of the highest in London, even though we've been at the lower end over the last couple of months. That's just over 6,000 people in Ealing testing positive each week, which is very high. Over the late December, we were seeing the rates particularly high in Ealing and Acton. Whereas in the last week, we are starting to see that really shoot up in Southall. The testing rates have gone up in Southall and the infection rates have really gone up. So some of the other towns are showing a plateauing or a decrease. Southall is showing a continuous increase in recent days. So that's obviously something for us to keep an eye on. We are seeing most of the cases in the adult age group, and the school age children are starting to rise now. As well, we have seen an increase in older people. So the over 60s age group, just when we came back after the Christmas break, that had doubled over that Christmas week. But we aren't seeing a massive impact of that on hospitalizations at the moment with the relatively high vaccine rate, but there's still time to see how that goes. So that's something we are keeping an eye on. The number of deaths is thankfully very low in Ealing, but we are seeing a few each week. Next slide, please. Thanks, Kerry. So just wanted to summarise where we're up with testing. There's been a lot of noise around testing over the last few weeks. You'll have seen some of that in the national media. Testing for people with symptoms, so using the PCR tests, or for people without symptoms using the LFD tests. That's absolutely increased massively since the start of December, partly because of the infection rates increasing, so more and more people having symptoms or being close contacts and getting tested, partly because there's been a very big national push and guidance changes in terms of using the home testing kits, the LFDs, much more regularly. So especially over Christmas, there was definitely a message about using them daily if you were going out to work or going somewhere busy like shopping centres or cinemas. They've also changed the guidance recently that if you're a close contact of a case and you're vaccinated, you don't have to self-isolate, but you do have to have a LFD every day for a week. So a lot of people have been wanting to get them. So Ealing, like everywhere else, has seen some issues with that. People with symptoms, the same offers there as it has been for a number of months now with the 3 testing sites in the borough. And the testing site at Gurnell changed to every day rather than every other day. So that really helped with our local capacity. And then with the LFD testings, we've talked before here, Chair, about having done a lot of positive engagement with local community groups, local pharmacies, linking up pharmacies with some of our religious settings, which has been great, and some of our charity settings as well. More recently, because of the national issues with people getting hold of LFD tests, we have been helping out with that recently. So a number of organisations have got in touch with us over the Christmas period. So police, TfL, some of the local NHS trusts, the vaccination centres, mental health and early years teams. We've been helping out with providing test kits for where their normal sources have dried up over Christmas, but that's settling now. And we are getting tests back out to pharmacies and libraries again. So next one, please. Contact tracing, because the infection rates have gone very, very high over the last few weeks, the capacity has just been absolutely tested to the max, and that's the same across the country. Our local team has been doing amazing work. They've been really trying to prioritise the people there, following up, especially in terms of older people, in terms of checking on them, checking on their well-being, pointing people towards Ealing Together. What we have had to do is quite a lot of our local residents, if they test positive, are now being followed up by the national team rather than the local team in that first 24 hours. And at the moment, just from the last few days, we've had to really restrict that just because of the sheer numbers coming through the system. So at the moment, we're following up people from Acton and Southall, where this was a very pragmatic decision. One of the really, really good positives about having a local team is some of the community language is spoken. We've kept hold of Acton and Southall, but everybody else is followed up. It's just by the national team rather than us, and we'll review that on a fortnightly basis, and hopefully we can get more of our cases back with the local team. And then just finally, I'm sure Kerry might touch on these later. We have got a number of care home outbreaks currently. They're relatively small, relatively mild, but we are seeing, like a lot of the rest of London, a lot of care homes having a handful of cases in staff or in residents, and a lot of those, we've got 18 care homes currently closed. We've talked here before about the vaccination uptake among care home staff. We were highest in London with that, which was great. The boosters less so, and that's the same in other boroughs. Flu vaccination still remains low, so there's definitely work that we're carrying on there. And the same with the domiciliary care staff. That's still on 85% with the first dose of domiciliary care staff. So that's definitely an area that we're still pushing on. The only other thing, Chair, I wanted to add about the vaccinations before passing on to Neha is that we have just in the last couple of days had confirmed that we've been successful in a bid for £485,000 of national government funding for community vaccine champions. So really pushing that community engagement side of our work and really giving us the resources that will help maximise and enhance the work that we've already been doing and really push that good work we've been doing with local community organisations. But if you're happy, Chair, I'll pass on to Neha unless there's any questions. Thanks, Kerry.
On mute. Thank you, Anna. Can I just check that we don't have any questions around that whole section before we hand over to Neha? Are there any questions from colleagues with regards to any of the information that's been presented there? Is there anything anyone wants to follow up? I'll give us just a minute to see whether anyone wants to indicate. I'm not seeing anything at this point. Oh, no, I am. I'm sorry. I've got Councillor Conti to start with, and then I've got Piotr. So let's go to Councillor Conti first, please.
Thanks, Chair. I just wanted two sort of small questions, really. One was just on contact tracing. It sort of just sounds like, from what you were describing, it's sort of become a bit more in terms of, you were talking about sort of follow up, pointing people in the right direction. I guess when case levels are so high, and I think the ONS says almost 1 in 10 of people in London have COVID, in terms of the benefit of actually contact tracing and more in terms of checking in with people who actually have been tested positive, in terms of probably that, whether that's actually maybe more of what they're doing now. I just sort of a bit more about that. And then the second thing was about these sort of community vaccine champions. That's fantastic that obviously that money has been won by Ealing for this bid. I was just wondering, with that money, what sort of what's the time scale of that's going to be spent on? And I guess sort of thinking sort of more longer term, sort of these people who become vaccines champions, is there a plan to think about how actually they could be used to become health champions? So champion in terms of other sort of key, health concerns. I know we're talking about inequality later on, but how could those be mobilised, further down the road as well? Or is this just a very short-term project?
Okay, I'm going to ask Anna to answer both of those now, and then we'll take the rest of them because they're two fairly detailed questions.
Thank you, Chair. Thank you, Councillor Conti. You're absolutely right. The benefits of contact tracing when the rates are so high, especially as they have been in London the last couple of weeks, reduces. The other issue is that with Omicron, there is a general understanding that it's being transmitted much more quickly than previous variants. So instead of it taking, say, 3, 4, 5 days, if you're a contact to then develop symptoms yourself, you're maybe talking a couple of days. So it is moving much more quickly between people, and therefore contact tracing becomes less beneficial. It still has massive benefits, especially if you're, say, a frontline worker or linked to a workplace, something like that. Less so within the household, but it's still important. But I think you're right, Councillor Conti. Some of it is more checking on people, checking they've talking them through the contact tracing process. I had COVID myself a few weeks ago before Omicron happened, and even did the online form. It took about an hour and a half. So it is quite a detailed process, and it is something that, you know, a lot of people need support talking it through and identifying their own context, just to let people know, and especially for people to be careful themselves, especially over that festive period. So, you know, thinking twice about seeing vulnerable relatives, etc. So at the moment, we are trying to concentrate our local resources where they add most value. So it was under 18s who up until a few days ago weren't able to use the online form. They were only over the phone, so concentrating on those groups, and then older groups or people that have travelled recently. So really trying to focus the resources, but there is a question of how beneficial it is when it's that high. When the rates start coming down, it will get more and more beneficial, and the local team will start taking on more cases. So I think we'll be in a better position then. In terms of your question about the vaccine champions, we are just, everything's moving very quickly with it. We were given like literally 3 days before Christmas to get in a bid for this, and we just got told a couple of days ago about it, which is great news. We are just pulling together a very short briefing for a couple of different people like the leader, etc. So I'm very happy, Anna Marie and Chair, we want to send that around this group as well, and that will be in the next few days. The time scale is essentially from now. They've said start spending the money now, and some of it, like I said, was enhancing or extending things we're already doing, as well as rolling out new parts of the programme. And it will run up until July for this phase. Whether or not there'll be anything after that, I'm not sure. Like you said, Councillor Conti, I'm really hopeful with all the learning we've had from COVID and other types of community engagement, that it's something that we can then carry on with after July, and not just in a COVID setting. We have the work we've done recently, I think we touched on last time, about some of the work in terms of, say, homeless groups and things like that, and some religious settings. Example, going out there and just talking about COVID isn't necessarily particularly helpful or particularly interesting for people, whereas if you're packing it together with other things, so there is a question of how we use those champions going forward. But yeah, it's a really exciting opportunity, and something I hope we'll be able to come back here with an update next time. Thanks.
Okay, thank you, Anna. Piotr, you were next.
Yes, thank you, Chair, and I thank Councillor Fabio for stealing my question about the community vaccine champion. So I can put my hand down and you can move on.
Thank you very much. Great minds think alike. Councillor Mohan.
It's a quick one, Chair. Just a bit of clarification, really. I know the laws are made by the central government in relation to lateral flow tests. People used to get free kits from the chemists and other outlets, but now people have to kind of approach the chemist and get a code and so on. I mean, that's fine, but I'm concerned about people who don't have access to smartphones. What is the facility for them so that they can make use of this this facility? Thank you.
Go on, Anna. Yeah, sorry.
Thanks, Councillor Mohan. So yeah, it has been tricky over the last few weeks to get hold of these kits, and things have come and gone. Pharmacists should be getting more testing kits from end of last week. The national government pretty much doubled its capacity in terms of testing kits and distribution. So pharmacists, libraries who we stock directly, some of our local pharmacists who do the assisted testing. If somebody has a code, great, go along. I have a feeling they might have got rid of that in the last few days, but I can confirm that and let Anna Marie know. There are about, I think there's 17 pharmacies across the board that do assisted testing. Definitely don't need a code for that. Just go along and ask for support, and they can show you how to use them as well. And also 119, the phone number, you can ring in terms of accessing kits as well. And if people do have access to online, you can get them delivered to home as well, which is great for people who are more restricted in terms of movements or don't really want to go out and about into shops and things. But I'll double check about the code and let you know, and I can send through the link to our website that says where people can get hold of tests as well. Thanks.
Thank you, Anna.
Thank you, Councillor Mohan. I'm just going to check because I missed a couple of indications when I was scrolling before, but I don't see any more indications from members of the panel at this point. So in that case, I'm going to ask Neha to take on the second part of the presentation.
Thank you. I'm just going to share my screen. So I'm hoping you can see my slides now. So I'm just going to quickly go through where we've got to with the vaccination program over the last few months. It's been a very busy couple of months, as you will all know. So these are quite busy slides, some of them, but I'm going to talk through some of the key comments on it and key messages in there. So since the beginning, well, we've been running the booster program for quite some time now, but as you will know, we were asked to increase the speed at which we were delivering the booster vaccinations during December and try and vaccinate everybody that needed a booster by the end of December. We had to immediately step up our capacity quite significantly across the borough. We've done that in a number of ways, and I'll talk through some of that in a moment. Just to give you context of where we've got to so far, what has been fantastic is by stepping all of this up and the communications, a number of people have come forward for their first doses. So today we received a report that we finally reached 70% of our 16 plus population have had their first dose. As you will have known, it's been around 65%, but the last few weeks has really helped us move that forward. And about 65.1% have had both doses. We've got about 41.6% of the 6% of the population have had boosters. So that's 153,000. So we are over we're more than 500,000 of our population that have, well, 500,000 doses of vaccine and more that we've delivered through this vaccination program. We're about to restart the schools program again, where it started this week with 3 schools this week to get the second doses for 12 to 15-year-olds. But over the Christmas and December period, we had actually opened up a number of sites who were also giving second doses for 12 to 15-year-olds. And 5 to 11-year-old vaccinations will commence later in the year once we've got some more clinical guidance and training requirements and everything have been set up. But that's not ready yet. We had a fantastic take-up rate and very busy take-up rate right the way through December. Since the new year, we have had reports, and we've seen it in the data as well, that the take-up rate of vaccinations has really dropped. Now, that will be for a number of reasons. One, a number of people had COVID just before Christmas, and then they wouldn't be able to have a vaccine for 28 days. So there could be a lot of people in that category, but also some of the messaging around Omicron not being as making you as critically ill. Maybe some people are just delaying having their booster vaccination. So we've got a lot of work to do to try and increase our take-up rate because it is so important. We have also worked with our GP practices in the local borough, and we now have 47 practices of our 72 that are assured and are delivering clinics, including, you will remember, we had 2 primary care networks in the north of the borough and around Greenford that had opted out of the programme. They have since opted back in and have all been assured and are delivering vaccinations from their own practices as well. So that ensures patients that are registered at those practices can come and get their vaccine at their local practice. There is a large amount of vaccine available across the system, and there's plenty of capacity for people to get vaccinated. At a lot of our pharmacy sites, our GP practices are calling people in. We have the Dominion Centre and we have CP House as well. And we ran a major event where Dr. Vijay Taylor was actually Gold Commander for that day at Wembley just before Christmas as well. So there's been a lot of work to try and get as much vaccination rates as possible, and people have been able to get that. We have had a lot of vaccine into the system over the last few months. So we have got a lot of vaccine in the system that needs to be used up pretty quickly. So we're keen to make sure we don't waste any vaccine. It is classed as liquid gold in some cases. So we do need to make sure that we try and utilize all of it. So we won't be getting new deliveries over the next couple of weeks, but instead we'll be moving vaccine around the system to make sure we're utilizing everything across our Northwest London system. And some of you will know that we've been running clinics, what we call pop-up clinics at St Mary's Church in Acton, but also St Mary's Church in Ealing. And we've been really successful in targeting some quite really vulnerable patients over the last few weeks. And I'll talk through some of the examples of what we've been doing there in a moment. And that shows that the work of having those vaccine champions is critical to having those conversations, those one-to-one conversations with making sure that people are taking up the offer. And I'll talk about that in a moment. We also know that as per legislation, all healthcare staff will be required to have 2 doses of the vaccination by 31st of March. And there are some staff who have not had the vaccine. So we'll be doing a lot of work over the next few weeks and months to try and get as many people vaccinated as possible. So just talked about Acton a moment ago. These are some of the examples of what we've been doing there. We've had our CCG staff deployed to supporting that site, where we've had either the Mattock Lane Pharmacy team or our Northwest London roving team running clinics there. It's about 100 vaccinations a day, so not huge amounts, but really targeting some of the really vulnerable cohorts. And Acton has been an area where we haven't had as good a take up as some of the other parts of the borough. And we've had, even today, we had another 6 patients come forward for their first dose today, and every single day we hear reports of how many more have come forward for their first or second doses. So examples on 22nd of December, we've had 25% of the 179 that were vaccinated were from vulnerable groups, and they've been working really hard linking into the asylum hotels, but also some of the homeless hostels and clinics that have been running, and our vaccination team at Mattock Lane Church, Mattock Lane Pharmacy, have been working with us to try and think of different ways of engaging those populations and trying to get them vaccinated. To the point where our staff have also been manning some of the stalls just to allow the market stall owners to come and get vaccinated as well, just around the corner from them. There's some really great stuff happening around there. This just shows you all of our practices that have been assured to run vaccinations. And anyone that remembers previous maps, we had gaps in delivery sites in Acton and the north of the borough in these areas. But now, as you can see, because a number of practices are now delivering the vaccination, the coverage is a lot better. And this graph just shows you, this is just some of the data that we have around the vaccinations. So with the different age cohorts, so the blue bar is that a person has had 44.2% of that population have had all 3 doses. The green is first and second, the small blue is only first, and the grey is unvaccinated. So you can see by age group, and it starts from 80 plus down to 16 to 17-year-olds, you can see the variation. And this is by percent uptake dose by ward as well. So you can see the maps, and you can see the Acton area which has had a lower uptake previously. I'm nearly finished, and this is just around age. Same with, this is a first dose, second dose, and first and second dose, sorry, up to the booster dose as well. And with this is with gender. And then our usual deprivation charts, and you can see that there is a variation between population, ethnicity groups, but also deprivation as well, and that continues to be. So this work that Anna was talking about earlier around the vaccination champions is going to be really critical to target those population groups. Happy to take any questions.
Thank you, Neha. Questions from colleagues around what was in that presentation? Councillor Mohan, your hand is still up. Now, I don't know if this is from your previous question or whether you've got another question. And maybe you want to advise on that. I don't know. I think it might be a legacy hand, but I'm going to take Councillor Taylor. I'll promote Dr. Taylor. Is indicating and you'd like to come in, Dr. Taylor. So please go ahead.
Yeah, thanks for that. This is not a question. I just really wanted to firstly acknowledge everyone's stellar efforts in terms of how we manage the COVID vaccination sprint program, particularly leading up to Christmas, and now we're in the new year. There has been a dip in the last couple of weeks, and I think that's partly related to the amount of Omicron circulating in the community, and hence people having to wait 28 days post-infection before they can have the vaccine. So I do expect there to be some level of surge in uptake, probably in February and in March. And we do have to do some more outreach work in certain parts of our community and population, and we are working closely with local authority to look at what we need to do over the next 4 to 6 weeks to encourage as many people as possible to take up the vaccine and the booster.
Thank you, Dr. Taylor, and thank you for the work that you've been doing, especially in terms of those mass vaccination events that to which Neha referred. I've got Kerry Stevens, our Director of Adult Services, would like to come in. So, Kerry.
Thank you, Chair. Just to support Dr. Taylor's statements about the outstanding work, which saw the vaccination levels of staff working in care homes in Ealing being one of the highest in London, which was an outstanding piece of work. The next phase that we have in terms of the mandatory vaccinations is looking at the vaccination of people working in wider social services and within the NHS. We're currently going through the guidance and legislation with regard to this, but we're expecting it to be, from a social care perspective, people working in the domiciliary care sector. But we'll keep you briefed on that, Chair.
Thank you, Kerry. I've got Councillor Steed. Good evening, Councillor Steed.
Chair, hi, good evening. I hope you can hear me.
Yes, we can. Sorry, go ahead.
Okay, thanks. Yeah, just really for picking up on that final point, actually, that Kerry Stevens mentioned. How do we ensure that there is a higher percentage of healthcare staff requiring to have the second doses, within the next 3 months? And are there any measures that have been put in place to try to make up any shortfall in the necessary numbers of staff that will indeed have both doses?
I don't know who wants to go first. Neha?
Yeah, I can come in. Thank you. So we already have quite a high take-up rate of vaccinations in healthcare staff, but there are inevitably a few that haven't taken up the vaccination. And there is a lot of work happening in every organisation around trying to understand why, myth-busting, trying to continually ensure that offer is there. We are awaiting national guidance on this and the approach to take, but we're working across Northwest London with all of our colleagues. So this will include hospital trusts, community trusts, all of general practice and everyone, to have a very consistent approach and a supportive method as well to try and encourage people to take up the vaccination and answer any questions. So we are expecting some more guidance over the next couple of days, which we will then take forward.
Kerry, you're indicating.
Thank you, Chair. Just say from a domiciliary care perspective, currently we have 85% of people working in the sector have had their first dose and 78% have had their second dose. And as Nahar said, we'll be working very closely across the system to ensure we maximise the number of people vaccinated going forward.
Sure. And Councillor Steed, your hand is up. I don't know if you want to come back. I'm going to give you the opportunity. Oh, it's good. Just
yeah, I know, but I will take. I'll take the opportunity, thanks, Chair. No, okay. I mean, I appreciate there is understandably a bit of vagueness around this, depending upon information that comes from central government. I mean, maybe we could be advised at a later date prior to the next meeting as to what progress is being made in this area.
Sure. So let's schedule in a progress report that can be sent round to the panel. Maybe on a weekly or monthly basis. I'll liaise with Kerry and Nahar in regards to how we all receive that. But I think that's a very sensible suggestion, so we can be kept in the loop. Piotr, you're indicating now.
Yes, thank you. I just wanted to follow up on the previous question a little bit. And I do also understand great efforts are being taken to try and convince employees to take the jab. But if you've got 85% who have, that means you've got 15% who haven't. So I'm just wondering, what are the contingency plans in place? For example, with community transport, we have a number of people who I know, even if the sky turns pink, will never get vaccinated. And therefore, I am making plans as to how to replace them. And if you've got 15% on the table, are we just hoping they all get vaccinated?
Sorry?
Thank you, Piotr. We're not just hoping, we're working very closely with the provider sector and with NHS colleagues to maximise the uptake of the vaccination. We know that when the law changes, that those people won't be able to work within the sector if they've not had both vaccines. We work very effectively and efficiently together around the care homes. Within the domiciliary care sector, it's a wider and more amorphous group of staff. So we've got a strong focus on this. All providers in Ealing have business continuity plans in terms of preparation for events which may see reduction in the number of staff available. But we also have a very healthy and dynamic domiciliary care sector link. So I'm relatively confident we'll be in a strong position by I think it's the 1st of April. Thank you, Chair.
Thank you. Dr. Taylor.
I just wanted to, you're absolutely right. There will be a small percentage of the healthcare staff in community trust and in primary care who have up until now refused to be vaccinated and will continue to discharge their choice, and so we will have potentially some staff that will move away from working in a patient-facing environment into other forms of employment. That is inevitable. It is going to happen because of the mandatory requirement to be vaccinated in those working conditions. At the moment, each GP practice, our community providers, our NHS trusts are looking at that, and in terms of the mapping process of where there is this lack of uptake, and how individual organisations are going to either redeploy staff, particularly larger organisations, and there will be a redeployment framework guidance that's going to be released quite shortly. But in small organisations like individual GP practices, where it is virtually impossible to redeploy staff because they all work in a similar environment and they all do similar tasks, that some staff will move on and new staff will come in who have been doubly vaccinated. that is a reality that we all have to face.
Thank you, Dr. Taylor. I'm going to go to Alan Cook now.
Thank you, Chair. It's just a question about the NHS staff. We're talking about 2 doses of vaccine, but actually the government are telling everyone to get a booster dose. So what is the situation with NHS staff? Are they now supposed to get a 3rd dose or not? And will this actually affect the 2-dose regime that they're supposed to have had by this? I think it's the end of March, is it, or sometime?
That's right. So it's the legislation is that the NHS staff have had two vaccinations. So in effect, for them to continue working from the 1st of April, they will have to have the first vaccine at least by the first week of February, if they've not had the first one, and then subsequently the second one 8 weeks later. So it is the 2. Yeah.
Okay, thank you, Dr. Taylor. I'm not seeing any other indications. I think this is really useful in terms of clarifying some points, and there are some things then that I'm going to ask colleagues to keep us apprised of. But I would like to, on behalf of the panel, salute the hard work of all of our staff, all of our volunteers, and everybody connected with this massive effort in terms of vaccination, because it goes right across the community, and the ongoing work to ensure that we're staying safe and well as best we can at the moment. You know, we've expressed this many times, but it's always heartfelt, and I hope that colleagues from the NHS can pass that along to everyone who's putting in all the hours to keep us all safe. It is very much appreciated, and the community is with you. Thank you so much. And thank you for your time this evening.
Chair, can I just second your sentiments? Thank you.
You can do, Councillor Steed. I stuck myself on mute there for a second. We're going to move on to our next item, which is the Health Inequalities Report, to discuss health inequalities within Ealing and some of the plans that we have in place to combat some of that. Anna Brydon is going to present, and I think we've got screen sharing going on, so I'm going to hand it over to Anna. Councillor Steed, I think you need to go back on mute, or somebody needs to go back on mute because there's some clattering going on. Thank you.
Sorry, I've just got a small toddler attached to me, so if I disappear, Daddy will come and get him in a minute. So the inequalities report is really requested by the panel to just give an update on where we're at with inequalities, really an update on data, and really help steer the conversations around the forward plan. Just wanted to talk through this. Can you just give me 1 second, Chair? Apologies.
Of course, you're very welcome to take as long as you need. So if I can just speak briefly about what our intention is with regards to discussing health inequalities. It's obviously a priority for the administration, and it was our thinking when we discussed this and some of the things that have come out of the pandemic, that it was very clear and stark the health inequalities during the onset of the pandemic. It's something that we probably haven't tackled in as much detail as we would like, both as a panel, but also I would say as the council as well. So that's why we've asked for this information to come here to give us an opportunity to discuss health inequalities and frame some questions around targets and improvements. So Anna, when you're ready.
Thanks, Councillor Corford. Apologies, my sleepy toddler just attacked me then. Just wanted to run through some slides. So we've shared in advance, and they're in your agenda pack, some much more detailed slides about this. Very happy to take questions on those. If there's any very detailed questions about data, it may be that we can come back with written responses on those. Just wanted to do this very brief summary slide pack here just to take you through the highlights. I'm just going to turn off my video in case it breaks down. So just talking in terms of health inequalities, what they are, obviously relating to differences in health and well-being, but we are talking very, very broadly here. A diagram on the left you might have seen before. We're not just talking about, say, lifestyle factors like smoking or people's, how they use health services, but it's much more what their social networks are, how they're linking with their community, living and working conditions, which covers such a number of different things like where people live, home environment, education, etc. And then much wider socioeconomic environmental conditions. They all interact, and I think that's something I'm really keen as we move forward in time with the Scrutiny discussions, but also with our joint strategic needs assessment, that we really do try and link up and look across factors. Obviously, an individual isn't just one factor, and I think we've seen that with some of the COVID data, that there are risks across a number of different factors. So you're talking, say, ethnicity, age, people working in frontline occupations, house of multiple occupancy, and if you add them all together, that is a much more enhanced risk there. I think one important thing just to mention, I've just referenced there a national report. This was by Professor Michael Marmot. That was a report done saying 10 years on. How is this looking? And I think they really found that in the last 10 years, health inequalities have actually increased. And so the people who are in more deprived situations are in a worse off situation comparatively than they were 10 years ago. Obviously, COVID won't have helped with that. So we are looking at a situation where inequalities haven't been magically solved in the last 10 years, and if anything, getting worse. Next slide, please. So just wanted to really do a very high level run through here of some of the information we're given in the slides, just to really help steer the discussions, Chair. So life expectancy is a very overarching indicator we show in terms of kind of health and wellbeing outcomes, where relatively high in Ealing, especially compared to national figures. So 80.9 years for men, 84.6 for women. However, the inequalities you'll see quite starkly across the borough. So, for example, areas like South Acton, Norwood Green have significantly lower expectancy. Areas like Northfield have higher than the average, and Southall as well comes up when you're looking at death rates from things like heart disease. Next slide, please. Thanks, Kerry. Deprivation and poverty, you'll have seen the little picture on the right a number of times, I'm sure, that really shows that kind of ring of deprivation. You can put that picture on top of things like ethnicity, income levels, languages spoken, etc. It's a very similar picture. We have got 4 small areas in the borough that are in the 10% most deprived in the country. That affects both older people and children as well. So Southall, for example, has high proportion of older residents living in deprived homes, and we've got 17% of children living in that 20% most deprived areas for children nationally. So it is very variable within Ealing, and we do see some areas that are in the kind of most deprived areas compared nationally. Next one, please. So in terms of health, there's a lot of different indicators. We've tried to provide a flavour of those in the bigger slide pack. Here, just wanted to talk really briefly about 2 that really kind of show illustrate the kind of inequalities we're talking about. Diabetes is a really big one. We've got a very high prevalence in Ealing. We've got almost 1 in 10 adults with diabetes, and some of those areas are particularly high. For example, Southall, Northolt, Perivale, and you do get a correlation of diabetes with some South Asian ethnic groups, for example. Obviously, the link in there with general well-being, life expectancy, heart disease, etc., and mental well-being as well, and the ability to work. So a really important long-term issue for us. The other one we've picked out is alcohol. So in terms of alcohol, people being admitted to hospital with reasons relating to alcohol, we've got the highest rate in London, in Ealing, and so and there are inequalities in there as well. So we've got a number of wards, especially around Southall, that are at that higher end as well. Next one, please. Just thinking about those wider kind of the kind of wider determinants there, and the wider kind of well-being indicators. Education and economy are two of those. So we've got 7 out of 10 children, when they get to the end of reception, their class is having what's labelled as a good level of development. That's significantly lower than the London average, and there are inequalities there, especially in terms of boys versus girls. We've got relatively high long-term unemployment figures, and that's going to only be exacerbated with COVID. The same with the annual household income. We've got inequalities there. Again, you've got, say, for example, some of the Southall wards with much lower average incomes than other areas. Next one, please. And then thinking really broadly, very much about the environment we live in. There was a separate scrutiny committee a few months ago that was talking about climate justice, and really about the kind of inequalities in climate change and climate action. You've got air pollution is a massive contributor to ill health, and an awful lot of inequalities in there, especially in terms of, say, housing design, where people can afford to live, people living near busy roads, etc. We've got council has an air quality action plan in there, but there's obviously more we can do along. That's a very long-term piece of work. Fuel poverty, again, 1 in 10 households in Ealing are in fuel poverty, and again we've got a number of support programs across the council, the NHS, the voluntary sector, that really aims to support households. But it's a really important issue for a number of our residents. Next slide, please, Kerry. Thank you. And then this was more just, I suppose, to start off some of the discussions and maybe to help think about future agenda items, Chair. So just wanted to bring out a flavour here across the council and local partners of the kind of things we're doing to tackle inequalities. Very little of this is brand new. A lot of this is, long-term actions and really, really broad. So in terms of that kind of overarching strategy, we've obviously got the Health and Wellbeing Board strategy, and we'll be refreshing that this year. And a lot of that will be looking at the inequalities that were highlighted, exacerbated with the COVID pandemic, and really thinking about how we can work broadly across the system in terms of those longer term inequalities. We've got a number of council plans like local plan for good jobs, etc. And then a number of targeted programmes. So Let's Go Southall. We've got some very specialist support services around things like FGM, TB. TB, again, is something that's particularly high in Ealing. Some of our sexual health and substance misuse services as well. And just wanted to really briefly mention 2 examples. These were very much a kind of judgment about what we picked here, but childhood obesity is a very much a long-term issue, something that has very quickly got worse over the COVID pandemic, obviously not just in Ealing. We've been taking a multi-system approach to that, and there's new work taking place under that as well. But again, that's us having a long-term focus in Ealing on those work areas. Employment as well. In the bigger pack, there's a lot more detail on this. There's a number of initiatives in Ealing across a number of partners, obviously not just the council, and across West London to support those programmes. So they're just things to really think about, I think, for the panel in terms of future agenda items, future areas we want to delve into. And just finally, on the last slide, just wanted to say a big thank you to colleagues, especially with the detailed slide pack, especially to Ruby and Mira, who put a lot of effort into really trying to condense an absolutely massive topic area. Very, very happy to answer questions and really help with discussions in terms of future items for the panel to focus on. Thank you, Chair.
Thank you, Anna. If colleagues could indicate, and I'm going to defer to Councillor Crawford, who was the first to indicate. We're going to see her presently.
Hi, good evening, everyone. Page 31, where it talks about older people, I'm quite interested to know what your view is with regards to the 60 plus range you've given. Though I think it's quite well established that there's great, the great numbers of over 50 males who are not able to re-enter the workplace following furlough. Strangely enough, the females over 60 are being more successful in keeping their work. Probably, different kind of work maybe. So I'd be interested in knowing if you've given a consideration to this in planning, because I think we need to relook at that 60 plus age group, bring it down a bit. And I'm quite interested. I actually visited a piece of casework today, and I actually visited a resident who is, ticking all the boxes with fuel poverty, low income, looking and having great support. I think it's from Breams in accessing support in getting, entering the workplace. But the home environment is absolutely crucial, and that's what she was talking about today, because the house is damp. It's an HMO, officers, it has been inspected, but things still keep coming back. And I suppose really what I'd like is any work that can be done cross-departmentally in actually working, and campaigning for the government to give more, more support to addressing our selective licensing issues, where we need more inspections, and obviously it's funding, and thirdly, I am concerned about what's going to happen in April, May, when fuel prices go up massively. So the very people that the constituent I met with today, I mean, it's bad enough already. The heating is poor. It's very expensive at the moment. There's damp. There's nowhere to actually dry her clothes and things. It's really, and she's got 2 children with special needs. So the home environment is absolutely crucial. But I am so very, very concerned that there will be the numbers will that enter into food and fuel poverty will increase in April. So I suppose really what I'd like to know is, are you thinking about this, and what plans do you have, and will you target different areas of the borough to almost tailor the services that you can, and the kind of support you want to give? Sorry, Chair, for taking so long.
Well, no, sorry.
Thanks, Councillor Crawford. So I think with a lot of these, I'm obviously sat here on behalf of a number of departments across the council. So if it's all right, Chair, I think it's going to be most useful if I can come back with some written responses on these from other colleagues in the next few days. I absolutely agree that over 60s cut-off doesn't, it's blunt, and it's just how we use some of the data. There obviously are other groups affected in that way, and definitely in terms of the issues in terms of employment, fuel poverty. There's a lot of cross-department work on that. I can get a summary of that for you. That isn't new, but in terms of some of the issues you've raised, Councillor Crawford, around licensing, etc., I can come back to you on that. Fuel price increase is absolutely something that's on council and other people's radar, in terms of especially over the winter, in terms of kind of planning from almost an emergency management point of view. My understanding is it's not a case that there'll be shortages of fuel to any significant extent. It's more that the prices will go up, and obviously a knock-on impact on people needing support on that. So that's definitely something that is on the radar, but I can come back to you with a better answer on that, if that's okay, Chair.
We were on mute, but Councillor Crawford was asking if it can be shared with the panel, and of course it will be once Anna has provided it. Councillor Conti, can I come to you?
Thank you. That was a really informative slide pack. And I had a couple of question comments really. One was about, so there's a section in the sort of more extensive slide pack about tackling childhood obesity. And I know you mentioned in the presentation about a lot of that stuff isn't new, but it was just really about, so there's a graph in the slide pack which looks at sort of obesity rates, and though they've rapidly increased over the last sort of couple of years, they had been quite high and sort of really high, sort of staying high for sort of going back, I think, 16 years on that slide. So there's not really been much change with, you know, a number of these interventions you're talking about obviously have been going on for quite a prolonged period. I guess it's just about how are those individual projects evaluated as we go along to actually really see what effect they're having, given that, you know, overall, I know obviously they're dealing with individuals often, but overall there hasn't really been much of a shift in a positive direction when we're talking about obesity. And you know, in terms of, I think there was one of the schemes is new, and I think it says in brackets launching shortly. I guess maybe what learning has been taken from some of the other schemes that have gone before it to maybe look about how maybe it could be more effective. And then just some of this made more of a comment really about digital exclusion, and that, you know, more and more, you know, whether it's council services accessing medical care, you know, employment, etc. It's about, you know, you need to be able to do that digitally. And I wonder how that feeds into sort of wider, not just about health, but how the council's approaching tackling inequality, or how, you know, its approach to it, and how we can ensure that people aren't being left behind just because they don't have digital access.
Yeah, go on, Anna.
Thanks, Councillor. Sorry, I'm just frantically typing in the background here so I can take away queries. Childhood obesity, absolutely agree, Councillor Conte, is one of our massive issues, and I think linked with the adult diabetes and heart disease rates, it's obviously a kind of long-term concern there. I think I'll come back to you on the questions around what's happened before, how have they been going, what's the evaluations, and how that's informing the new work. Absolutely. It isn't, apart from COVID, that's obviously been something absolutely massive and dramatic in terms of doing a very quick change. It isn't the kind of thing that changes quickly, and especially in areas like ours that have the high rates, that is a kind of medium to long-term issue in terms of bringing that down. And it's a multifactorial issue. One project isn't going to make a massive difference, but I can definitely come back to you with some of that questions on the evaluation. Definitely. Digital exclusion, again, I'll come back to you. My understanding is that we have got quite a lot of partnership work on digital exclusion, so especially across the council, across the voluntary sector, across NHS partners. It's something that's being picked up even more importantly with the COVID pandemic in terms of health and care services going online more. So again, I can get a summary round to this group if that's helpful, Chair, in terms of where that work is at and upcoming plans there.
Thanks, Anna. So I would speak just a little bit about childhood obesity, because we did do a major review from this panel only a few years ago, particularly with regards to some of the work that took place specifically in Southall. And while Councillor Conte is correct that, you know, the overall graph and the overall picture from that graph remains broadly similar, some of these projects did make a lasting difference in certain localities, and certainly initially it's about cultural change, and there was very strict evaluation processes with regards to funds that came from the then Mayor of London, who's now the Prime Minister, and national government as well. So, you know, we can dig some of that information out, but I think one of the purposes of starting this conversation is absolutely to look at how we evaluate our progress against a set of yardsticks, and what we can do to drive change, both in terms of numbers, but also culturally for us as elected members and as representatives within our communities too. So yeah, I think there's a strand of work that sits alongside that quite well. I just want to speak to some of the panel's previous work there. Alan Cook was next.
Thank you, Chair. Actually, you and Dr. Conte have actually brought up the issue that we've been dealing with childhood obesity for years. I've been sitting on the panel now for 12 years, and I'm sure it's come up more than once. There have been several reports. So really my big concern is why haven't in the past we had been able to deal with this problem? And going forward, what issues are there going to be that we'll be able to address? And the other thing which I pointed out to Anna was that I do have some problems with the data, which she has sort of referred to. So I don't expect an answer tonight, but what I would like to know is, how are you going to deal with childhood obesity going forward? What sort of things are in the pipeline to make an improvement that hasn't happened in the past?
Yeah, thank you, Mr. Cook. And in terms of your data questions, we've got those, and we'll come back to you over the next couple of days with those. Thank you for highlighting them. Absolutely, again, referring to council content, this is a long-term issue. No single project is going to, however brilliant it is going to make a difference even within 5 years on this. It's absolutely, the number of factors involved in childhood and adult obesity are huge. So that first slide I showed that was looking at all those different factors, when you kind of map out the factors involved in obesity, all of them are touched on. So each of these projects that we do really helps, but an obesity project is not going to solve childhood obesity. It will help, and it will really help a lot of families support with keeping children and young people maintaining a healthy weight, but it's not going to solve inequalities. It's not going to solve income issues, education issues, culture, all the different factors we're talking about here, which is why it's looking at, yes, some initiatives and some programs and some services that we have in place, and that, we are hoping to improve over the years, but it's also having that massive multi-system approach in terms of inequalities, income levels, etc., as a whole, which is one of the reasons we wanted to highlight it here. It's not an easy one that will be solved quickly, but definitely one, I think, for the panel to keep coming back to, because it absolutely is an indicator of other inequalities and, like I said, kind of long-term health issues. We are currently undertaking a needs assessment on this, because it's quite a few years ago that we last looked at the data, and like I said, the COVID pandemic has changed some of those figures, none of it in a surprising way, but the figures have shifted, so that's the first step. We have been working on the last about 9 months now. One of our integrated care partnership groups is looking at a healthy start, and childhood obesity is one of those. So they've been doing a lot of mapping of all these different aspects, because obviously different organisations, different services will be doing their own thing, and some of them know about each other's, but not all of them. So trying to pull that together, what the next steps are, and that I'm not sure, because that work is still underway. But I think it's definitely something for this panel to keep hold of as a issue, and also as an indicator of other inequalities. Thanks, Chair.
Thank you, Anna. I have some questions, but I'm going to defer to colleagues just to make sure we get as many people in here as possible. If you can indicate, because I'm looking to see, and if nobody indicates, then I'll take my opportunity, which I shall do now. Then, in that case, I think this is a broad starting point in terms of numbers, and I shared this with Anna as we were compiling this report. But I think the thing that strikes me when analysing these problems is we talk oftentimes, and you did just now, about the need for a multi-system or cross-departmental approach. And I just want to hone in on how big a commitment there is to that, because so many times we sit and hear the councils describing an approach as one council, and so many times it doesn't always translate to lived experience of residents, whether that be in Southall, where they have issues, whether that be in Acton, whether that be in some of the other places that you've referenced where things have not gone according to plan, or the data points out that there are real problems. So, how strong is the commitment, and how much are we going to look at changing some of our commissioning arrangements, what we commission and how we do it, in order to really tackle this problem? And I'm aware I'm asking an officer rather than an elected member, but please be reassured that we will make the same ask of our elected colleagues in due course as well.
Yeah, thanks, Councillor Crawford. I think it's a reasonable question. As you know, I don't have a massively long history in Ealing, so some of it I'm still catching up with myself. But I think even I can see over the last few months some of the different initiatives and programme areas where we've been working together across the number of different partners here, council, health, voluntary sector, residents associations, etc. I think really makes a difference. I think COVID is showing some of that in a really blunt way. And especially the community engagement side of that, I think is something that is really going to be developed across the council. So that's something I'm really keen to support with. I think the integrated care partnership that's been formed over the last year or so, obviously COVID's been in the middle of that, which hasn't helped in some ways in terms of speed and capacity, but those feel like very positive discussions. It feels like a very mature discussions. And really helpful for that work to kick off. I'm really hoping this year, once we get over the next month or so with COVID, that can really push forward. And I think for me, feeding into the health and wellbeing strategy, that for me is a really, I know it's just a document, but that for me is a really, really good opportunity for all of the local partnerships to really come together and make some promises to each other. Even if for me, even if it's a handful of things that we do together, rather than trying to be as comprehensive as humanly possible, I think that will make a real difference. And it's a really good opportunity for me to look at that much wider picture. So for us, from a council point of view, I think with that health and wellbeing strategy, we'll be pulling in our place colleagues a lot more. So it's not just, say, myself, children's and adults colleagues, it's much wider than that in terms of those wider determinants across the ICS, so the integrated care system across Northwest London. There's been a lot of work already on that kind of work. So for example, around anchor institutions, so council, NHS trusts, big employers, etc., that will always be in Ealing. What does that mean for our local populations? How can we support local residents? What's that mean in terms of employment opportunities, etc.? So those conversations aren't brand new, but even over the last year, I can see a shift in the types of conversations we're having. So I'm very hopeful for the future, but none of these are short-term issues. These are long-term things we'll be working on. But I think, Chair, like you said, I think some of it's having the answers from a councillor point of view as well. But yeah, that's for me for now. Thank you.
Well, thank you, Anna. I'm going to go to Piotr.
Okay, yeah, I think it is a bit like trying to stop the tide coming in, or it feels like that sometimes with a huge problem like this. But I'm quite encouraged by some of the things I've seen recently. Participation, for example, in the Ealing half marathon. And, if you start talking to all the schools and get the children enthused, but also childhood obesity can be, I think, affected a lot if you manage to change the family. So things like Boris's bike repair scheme, if that gets the parents on their bicycles, then we can affect children in the same way. So I think it is a myriad of different organizations across the sphere of community organizations, council, etc., have to come together. And unfortunately, fortunately, if you have a plan like that, these little bits make a huge difference, and they can combat the no-sayers who say, look, you've closed the swimming pools, look, the children are spending less time on PE. But if we get the right people together, the plan is going to be long-term and it is going to be slow. But there really is, I think certainly COVID has shown that people can get out there and can. I mean, we've just had the new park run in Southall, haven't we? So, this is, there are signs that this can be done. And I hopefully everyone will come together and support this, because for our children, I mean, it's one of the most important things.
Yeah, thanks, Piotr. And I think for me as well, that link to the families is absolutely crucial. So things like Let's Go Southall with the bike project that's been running and starting over the last few months, something like that is massive. And just really having the practical support, the culture change, that peer support, and the support with repairs, learning to cycle, etc. I think that kind of thing is really crucial. So yeah, absolutely agree. Thank you.
Can I take Dr. Taylor?
Yeah, I don't want to repeat what's already been said, but as we're all saying that this is a national priority in terms of childhood obesity, and the resources to tackle that need to filter down to a borough level. But I think it's really not about reinventing the wheel. The same problem that's in terms of childhood obesity in Ealing is the same as it's in Brent, as it's the same as in Hounslow. And we all know it is very much multifactorial. And like has already been said, all those small little interventions in a cumulative effect can have a positive benefit. But we all know it's a minimum of a 10-year program in whatever we do in terms of childhood obesity. From in terms of re-educating the parents about physical activity, the level of physical education in school curriculum, the amount of a sedentary lifestyle that children now have, particularly with respect to smartphones, iPads, gaming, online gaming, fast food outlets in every corner of our society. All of that is having a detrimental impact in terms of childhood obesity, and then the long-term health consequences of that. We already are seeing evidence and prevalence of type 2 diabetics in children, which wasn't heard of 20, 30 years ago. So yes, this is a national problem, and we need national priority, national legislation, and national directive that we can then mobilise at a borough level.
Okay, thank you, Dr. Taylor. I don't see any more indications, so I would just conclude my section of this by saying that repeating really what I said earlier on in terms of when Anna was beginning her presentation, that we view this as a starting point for this panel to take a look at some of these issues, to take ownership of health inequalities, and to scrutinise the work that's being done, and to offer support in that regard. But I think also we'll be looking to examine when targets are set up and when strategies are in place, measuring performance against that. I'd welcome comments from colleagues to myself and Councillor Conti as to how we can do that in the next year's worth of scrutiny, because I think this and the analysis of the COVID pandemic run hand in hand quite handily to give us some guidelines to work from. So I think that's where we'll leave this item for now, but I will certainly look for some buy-in when the strategies that Anna has referenced are published, particularly the updated health and wellbeing study. And I would say as well, we are looking to scrutinise the first year of the ICS when that is appropriate, and we've had that commitment from the NHS. I do think that gives some opportunities, greater opportunities for local authorities, and a new partnership, and we should examine what they might be. So thank you for your participation in this item, and we'll look to take it forward maybe as soon as our next meeting. Thank you very much. I'm going to move on to item number 8, which is the adult social care response to the pandemic and lessons learned. So we've got Kerry Stevens with us and Matthew Van Mol Jones from Health Watch. So this is an adult social care response to the Health Watch report that we heard, I think, in November, detailing some of the issues that have come out of the pandemic. I don't know whether you want to summarise what was in the papers, Kerry, or move straight to questions. How you'd like to do it.
Thank you, Chair. Just to say, this is across systems, so there's also contributions from NHS colleagues in terms of the work plan. Just to say, colleagues will recall that Matt brought the paper to us in November of 21, and the work plan that's attached with the agenda for today lays out progress against the areas and recommendations put forward by Health Watch. What I'd propose, Chair, is that we bring this on a rolling programme back to the committee for oversight and questions and challenge and scrutiny. So really opening up to questions, Chair, if that's okay with you.
Oh yeah, sorry, you caught me on mute. I don't know if Matthew wants to just speak to anything from Health Watch's point of view about the process.
Yeah, thank you very much, Chair. Just to say that it's a really comprehensive response. And I think what's key as we move forward and continue to review it is to make sure in the best possible way we're relaying information onto the public in a kind of you said we did type of whether it's just a brief news update or a short report. We just need to make sure that they're as clued in as we all are, to make sure that they can see the progress being made. But yeah, thank you.
Unmuting myself again, having real problems tonight. Thank you, Matt. So are there any colleagues with questions with regards to progress against any of the items that are in the report? I'll just give a second to see whether we've got any that would appear, because I have a couple. Let's go, Councillor Conti. Yes, please.
Thank you. The question I had was about, sorry, I'm just trying to find where I was on the sheet. It was, I can't remember which action or area it is, but it's the one about the amount of time that paid carers are spending when they visit. I know there's a number of actions there. It was just a bit more, I guess there's a little bit more information about the extent of the problem that we think that is, in terms of, you know, do we think that's a widespread issue? Is that potentially with particular providers? And it was just about how, I think the timescale on that, I think, was July 2022 this year, to look at some of those recommendations. But sort of an update really on that. That's all.
Thank you, Councillor Conti. It was certainly an issue that was picked up through the Health Watch survey, in terms of a number of people who were spoken to raised concerns about the amount of time that carers were spending compared to the hours that are commissioned. Obviously, the survey was carried out during a very challenging time in terms of pandemic response and capacity and staffing issues within the sector. What the work plan lays out is the contractual expectations and requirements on providers to meet the commissioned hours that we work with, that we commission with them for. Part of the planning is to look at whether we can look at a call logging and monitoring system, which has been applied elsewhere across the country, so that you're clear when people arrive and leave at people's homes, so that it's a more closely monitored system. We don't have that currently in Ealing, but we will review the situation and come back to you.
Great. Do you mind about, Chair, can I ask one more question? Is that all right?
Yeah, go for it. Go for it. Yeah.
It was just on respite for informal carers, and I know that you're looking at there's a gap analysis being completed. I was just wondering, in terms of sort of access to respite services in the borough and short breaks, do we, you know, what's your feeling in terms of generally the availability and the provision? Do we have enough for the demand, or is it something that there really is quite a large gap to meet what's required?
Thank you, Councillor Conti. And it's a really interesting point. We've got a number of commissioning reviews being completed or progressed currently. So there's a review of services that we provide for people with learning disabilities, and we're also starting a review of the mental health commissioning strategies. In those reviews, we'll be looking at the respite offer that's available to support families and carers for people, and to also give people who use our services a break as well. The current level of offer, I think, is sufficient. Whether it meets all requirements, I think, is something that we'll be looking into. I think that the point that we have to be very aware of, that during the period of the survey, there was limited access to some of the respite sites due to, so for example, the short break service, which is the council run service, and we reduced access to respite in order to manage COVID infection and outbreaks within the service. I think when the service is up and running at full capacity, then we have sufficient capacity in the system currently, but during the COVID outbreak, this was significantly reduced, and there was a significant impact on families and carers.
Does that satisfy for the moment, Councillor Conti? Yep, brilliant. Okay, I've got a thumbs up from Councillor Conti. I'm going to defer to Councillor Crawford. She's got a question, so I'm going to try moving this device around so you can see her.
Hi, I'm just curious to know if any concerns were raised by perhaps the younger disabled customer who feels that their visits for helping them, supporting them to prepare for bed or getting up in the morning suits their time, and whether, if this is the case, whether there's any work being done in, shall we say, more flexible ways of shift management for by the providers, because sometimes I think that maybe the staff may actually welcome, once they got their own children home, that there may be a group who would actually say, well, yeah, I wouldn't mind working in the early evenings rather than perhaps putting someone to bed at 5 o'clock. Thank you.
Thank you, Councillor Crawford. It's a very timely question. At the Learning Disability Partnership Board that was held this morning, we've been having ongoing discussions about a programme called Staying Up Late. This is a programme that's being led by national organisations for people who live in residential or supported living environments, to say that they should be able to go to bed when they see fit. If they wish to go out and see friends, go to the pictures, go to the pub, whatever people wish to do, they shouldn't be tied to shift patterns of staff for when they have to leave the pub or the cinema to come home because it's time for bed. So that's something we've been working at within the partnership board, and we've written to all providers promoting the Stay Up Late programme.
Yeah, so we're having our own discussion here. I'm going to refer back to Councillor Crawford.
Yeah, could you actually talk about the customers who are at home, possibly, living on their own, maybe one, but they obviously need that support, but being put into bed, supported into going to bed too early is not what they want. They're too young to feel that, and also it might not help them with not moving. It might not meet their sort of physiotherapy program to actually be put into bed for a long duration. So, Terry, come back.
You faded off towards the end then, Councillor Crawford, but it's certainly something we can look at for people who are living in the community rather than just people who are living in residential care homes. So it's something we can provide with the domiciliary care sector as well as the residential care sector.
Okay, thank you, Kerry. I've got Piotr to come in now.
Yeah, I just wanted to add one point on that. Very important that we understand that these people who are having this care are just like all of us, really, and we could be in that position one day. And I note that Transport for London, in terms of Dial-A-Ride, have just extended their times back into the evenings after shortening them into the pandemic. So these people who may need carers visiting and people who have mobility issues are now going out to the pubs again or somewhere in the evenings because that facility is now being returned to them. So it's good to remind the providers of care that they've got a customer in front of them that they're visiting, and not just somebody who should be happy that they're getting a visit at all. They are the customers.
Yeah, I don't know if Kerry wants to come in. He's nodding as though he agrees with it. He's said quite a lot on this section. Yeah.
Yeah, absolutely, Piotr. I mean, this is all about person-centred care, and included within the report, there's a briefing on the case file audits that we complete around person-centred care, and absolutely support your statement.
So I think, to me, this is the essence of the personalisation agenda, or what it was supposed to be way back when we were talking, when personalisation was in vogue, you know, much more towards the start of the millennium. This was what was supposed to be happening. And, you know, we talk about the strength of the market or how successful these things are, and we can sometimes only measure by individual cases and the experience. And I think Piotr and other colleagues are absolutely right. There's no there's no one size fits all approach, or there shouldn't be, for these types of individuals, because each assessment should be different. And I know that's something that's Kerry and his team have worked very hard on. To that end, Roy Willis is with us from Ealing Reclaim Social Care Action Group. He's a regular participator to social care topics, and Roy has a few questions based on this item to ask Kerry. I'm going to ask Roy to begin his questioning.
Thank you, Councillor Crawford. Yes, we've got 3 questions. And I put these in the, in the spirit of cooperation and trying to point out things, not to criticise unduly. The first question is about daycare, and we've previously raised issues about attendance levels at daycare centres having fallen, and I know that. So given concerns about the we've previously raised about the hopes of returning to at least pre-COVID levels of daycare provision, does social services know what the total attendance levels are at day centres across Ealing? And this is to take into account council-run centres, voluntary-run centres, and private centres and organisations that provide daycare, and particularly in relation to the council in terms of its own centre at Cowgate, and also dementia-related support that used to be provided at the Michael Flounders Centre, which is now used as a testing centre, I believe. But I think it's a question about trying to look at what priority is given to daycare, because daycare can be preventative, can provide respite and short breaks, and it can help with socialization, with fitness levels, and with health issues.
So thanks,
So
Roy.
that's the first question.
I'm going to ask Kerry to answer the question, and then we move on to the second question.
Thank you for the question, Roy. Completely agree with your statement that the importance of day services. I'm sorry, I apologise about my dog. The importance of day services and what a difference they can make to people's lives. In terms of providing you with the data, I'll have to ask my colleagues to gather that for me, and I shall feed that back to you through Anne-Marie, if that's okay. In terms of the position with regard to Cowgate, I'm pleased to announce that Cowgate reopened this week after a significant period of closure due to COVID, but also building works that were required to ensure that the site was safe. And as you mentioned, Roy, Michael Flanders remains closed due to the site being used as a testing site, but we'll gather that information for you and get it to you as soon as possible.
Okay, thank you very much. Thank you. The second question is about residential care, and given media coverage recently about care homes closing across the country due to financial unviability and because of low occupancy rates, is there a contingency plan in Ealing for any such problem arising now or in the future? And obviously, I don't mean homes that have closed because of infection rates and closed to new admissions, but the overall issue about their viability in the coming months due to lower rates of occupancy.
Thank you again for the question, Roy. So this is a significant concern, not only in Ealing, but across London and the country in terms of viability of the care home sector. As you'll be aware, Ealing is a net importer, so a lot of the central London boroughs will place people in Ealing. We've got the highest number of care home beds in northwest London and the fifth highest number of care home beds in London as a whole. We work very closely with the sector, but we also keep very close monitors on their financial performance, the quality of their services, and understanding what their capacity is. There are still voids within the sector, which is a concern in terms of the viability, but we're continuing to work closely and ensuring that all the monies that come from central government are directly passported to the sector to support the sector going forward. All care homes are required to have business continuity plans and to ensure that where possible that the council's informed if there's going to be any financial changes or issues.
Okay, thank you. The third question is just to reiterate what we've been saying before, that we're still getting reports of problems of local service users facing difficulties in recruiting personal assistants, support workers and carers. And again, would want to ask really what is being done to address such workforce shortages in Ealing. Thank you.
Thank you, Roy. So there's both local programmes for recruitment of staff into the social care sector and regional programmes across London. There is a Proud to Care programme, which is being led by London ADAS, which is supporting and trying to encourage people to see work within the care sector as part of a future career and part of a long-term opportunity for them. Within Ealing, we're working closely with our colleagues in the economic development department to look at promoting work within the care sector as an opportunity for people going forward. If you've got specific examples, I've spoken to our direct payments lead who wasn't aware of that there are specific challenges in terms of people having difficulties recruiting into direct payments as personal assistants, but please do let me know. It's also worth noting that the council's working closely with the Ealing Care Cooperative, which is developing a new employment model and care provision model, which we hope will bring a disruptor to the market and provide a different approach to how people are working in the care sector. So that's also an opportunity to promote employment within social care through a slightly different approach than would be seen in the more for-profit sector. Is that okay, Roy?
Yes, that's very helpful, especially to hear about the care co-op, because obviously an organisation like that could be developed and start providing services and providing care would bring added value, really, rather than just looking at the price mechanism.
Yeah, 100%. Kerry was gesticulating his approval about that. I don't know if he wanted to say any more. No, he's just going to stick at thumbs up. But I would say this is something that we've discussed at this panel and at other panels in the past. The cooperative model is something that would, as you say, bring a significant change into Ealing and a significant change to the market. And obviously, we're very keen to see that move forward. And I think the administration is as well, although we will certainly speak to colleagues around that going forward. So, we'll keep that under review, Roy. Thank you for your questions and your participation as always. And do let us know of any issues in between the meetings that you might want to bring to the attention of the panel, the cabinet or the officers themselves. I wanted to, if possible, just flag up the fact that the report speaks to one of the challenges being the implementation of the borough-wide GP telephone system. And there are two things with regard to this. The first is that it's delayed by virtue of the pandemic and some of the work that we spoke about earlier that's taking precedence at the moment. But Nahar and colleagues have promised us an update on the GP standard within Ealing, and some of these issues will be discussed there, but we haven't forgotten about those issues because, as channeling my inner Councillor Dinser, that is something that has been raised in previous meetings, and we will keep that under review, possibly as soon as the next meeting, but certainly through the next municipal year. But I would want to finish by commending this work. I think the approach is really important. It will only strengthen when Healthwatch are able to get back to some of their more conventional methods of reporting and surveying. And, you know, I would certainly endorse what Kerry has said in regards of bringing these update reports more regularly. That's something that I would certainly like to do. So thank you again for your participation and questions on this item. And we look forward to taking you through and hearing more about progress against some of those yardsticks in future meetings. All that remains for me to do is briefly touch on the work programme for March's meeting. It could be subject to change or alteration, so if colleagues have anything to do with the scoping of those reports or other matters that could be considered, do get in touch with myself and Councillor Conti, and we'll try to attend to that. And that meeting will be held on the 2nd of March 2022. So thank you everybody for your participation this evening. Thank you for all the work everyone's doing in regards to vaccination and the preventing the spread of the variant. And please do stay safe and well, and hopefully we'll see you all again soon. Thank you very much.